Hello and welcome back to the Pain Free for Life podcast. I'm your host, Dr. Rob Vanbergen, and today I'm talking with Dr. Karen Cureton. Dr. Cureton is a licensed naturopathic physician, acupuncturist, passionate neuroplasticity practitioner, and co-creator of the Wired for Wellness program. Through her own journey with complex chronic illness, anxiety, depression, and PTSD, as well as from treating hundreds of patients with complex chronic illness, she realized the profound impact stress physiology has on all aspects of health. By rewiring her brain and rebalancing her nervous system, she was able to free herself from anxiety, depression, PTSD, many physical symptoms, and stress patterns as well. She has since helped many clients do the same with diverse health issues, traumas, and self-sabotaging patterns. Dr. Cureton is now a firm believer that everyone with a chronic mental, emotional, or physical health issue will benefit from neural retraining, and in many cases, that it's critical to healing. You can learn more about Dr. Cureton, her practice, and the Wired for Wellness program by following her information in the show notes below. Now, today, Dr. Cureton and I discuss the power of the brain in creating real physical pain. I can't emphasize that enough. The brain is creating real pain. It is not made up pain in your head. But we also explore the potential it has in unwiring that pain and getting it back to having your brain work the way it is supposed to. Moreover, we'll even talk about the research that backs all of this up.
Welcome back to Pain Free for Life, where we share how to successfully overcome all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And now, here's your host, co-founder, and board-certified holistic healthcare practitioner, Dr. Rob Vanbergen.
Dr. Cureton, welcome to the show.
Thank you so much for having me. I'm excited to be here.
So I know we're going to talk about the brain today, which is one of the mystery organs of the body, if you want to put it that way. I mean, many people are very oblivious to the way their brain works and the way it interacts with pain. There's this kind of idea that you can't have mental and physical health be intertwined, right? And that it's all disconnected. And obviously that's very, very wrong. And we're going to be dispelling that today. So I'm going to start with a question about the brain. And I think that's where we're going to frame most of this. So how and when does acute pain, so that the natural starting point of our pain, right? We get hurt and it starts to hurt. How does that develop into chronic pain? And when it does, what changes in our brain in order for that to occur?
Yeah, great question. So what we have seen in recent studies is that the changes that take place in the brain that convert pain from being sort of acute, peripherally mediated pain, i.e. you had an injury and that's what's causing the pain, right? You're getting signaling from that injury to the brain, telling the brain, hey, there's danger, there's a threat here, right? And that's the normal acute reason we have acute pain, right? The brain goes, oh yeah, there's danger there. We need to produce pain in order for you to protect that body part so that you don't hurt it more, right? But what happens is that between 6 months and a year, the brain literally rewires itself, restructures itself to create the chronic pain state. So, in medical terms, this is called becoming centrally sensitized. And so when that happens, basically the signaling in the brain related to pain becomes a brain habit. So using these very fancy terms, I could describe this, but basically, let's do it in really simple terms. Whatever fires in the brain more frequently becomes stronger. So whatever we repeat, we get better at, right? And we tend to think of that just in terms of like skill sets, right? Learning a new language or learning to play the piano, we repeat it over and over again, we get better at it. But that also happens in the transition to chronic pain, that the more those pain signals fire in the brain, the better those circuits in the brain get at making pain signaling, right? Or creating the pain experience for us. And so then that starts to become the brain's new default. It stops actually needing signaling from the rest of your body about danger or about threat or about injury. And it just starts to be able to produce the pain on its own.
Hmm.
The other really interesting thing that happens is that emotional networks and motivational networks in the brain get wired in with the pain signaling networks. And so you start to see this transition to more and more and more activation of the emotional, limbic, et cetera, networks in the brain with the pain signaling networks. And it's very interesting. They actually describe it in the research papers as an emotionally driven learning process that somebody develops chronic pain. And there are all these studies now that support that the more someone is really afraid of their pain or really upset about their pain, which is a normal human reaction, unfortunately, it makes it easier for the development of the chronic pain state to occur. So those folks are more likely to have those changes occur in the brain that then creates the chronic pain state.
This has got to all be to do with perpetuating that fight or flight response, right? So they're starting to get into that fear response, which is very common. We see that a lot as well. People, and I, having been through chronic pain myself when I was younger, I remember how debilitating it was to worry that the pain was going to come back, even if I woke up feeling kind of okay that day. It's when is it going to drop? And it impacts your life in a way because it stops you being able to do anything that would take you away from your comfort zone, right? So absolutely devastating. And so getting out of that has to be a big part of it. But I have kind of a follow-up question there because the typical response we have to pain when we're dealing with it, most people out there, right, is to take something for that pain. Mm-hmm. So you go to the doctor, you get prescribed something, and you get prescribed more and more as time goes on. I know they do less opiates now, but it still is a thing in a lot of places. Now, surely that has to have an impact on these pain signals because, as you said, the brain is trying to get our attention, right? And then it's just, the more we mute it, that's got to be emphasizing the pain response and making it worse and worse. Is that true or?
Yeah. And, with opiates, it's very interesting. Opiates actually work in 3 different places in the body, right? So they actually work to dampen pain signaling in the brain. And then they triggered the brain actually to dampen signaling further down as well in the spinal cord. So opiates are the reason why they work in the chronic pain state and the acute pain state is because they actually address that signaling at multiple different levels. And, NSAIDs or the ibuprofen type of drugs, those work on peripheral inflammatory mediated pain primarily. And so if somebody has centrally mediated pain, they're not going to respond to that. If somebody's been centrally sensitized and that's the sole reason for their pain now, they don't have an ongoing injury anymore, they're not going to respond to those, but they will respond to opiates. But unfortunately, yes, you get into a terrible cycle with opiates because they are so addictive. And then it becomes really, really hard the journey just becomes longer, let's just say, because you have to get off of the opiate and then rewire your brain.
Yeah.
To get out of pain.
Totally. There's definitely that addiction side of things. And I always like to say that the brain kind of becomes, and I mean, it doesn't, I'm going to say something and then I'm going to backpedal on it. But we always used to say, that the brain becomes addicted to pain in a way. And you kind of mentioned it's a bit of a habit, and it's not like it's enjoying causing you pain by any stretch, right? And that's what addiction kind of makes me think of that. But it's dependent on, it just gets into that cycle and it keeps feeding and feeding and feeding the body and saying, look, we think about it like the brain is trying to tell you there's something wrong and you're ignoring it and you're ignoring it. And every time we take a medication, and I don't even really know, I always kind of think if it's muting the pain, if that's all it's doing, it's going to make it scream louder and louder and louder because it wants to help, right? It wants you to get help.
Yes.
So this brain that we have up here that controls pretty much everything we do, much of it automatically. So it's rewiring itself and it's changing itself. And how does this really perpetuate chronic pain as we go on, right? Because obviously, you got your 6 months to a year, as you said before, people kind of get diagnosed with chronic pain. But many people listening here may have been in chronic pain for 40 years or more, right? So has that gotten worse over time? Has the brain kind of kept it going? Want to speak a little bit on that?
Yes, totally. So, some of the things that tend to occur when pain becomes centrally sensitized is that the area that is feeling painful spreads over time, right? So, that's one of the things that tends to turn on a light bulb for practitioners that know about centrally sensitized pain to go, yeah, maybe the brain is really getting very involved here. The other things that occur, are that the pain tends to become more intense for many people over time. It also can start to become triggered by things that shouldn't really trigger pain. So, in a centrally sensitized pain patient, oftentimes we see things cause pain for them, like temperature changes or very light touch, or emotional events, right? Can really dramatically worsen the pain or stress, things like that. So we start to see all these unusual patterns of pain that you don't see in acute pain. In acute pain, normally if it's, injury mediated or inflammation mediated, you're going to be able to provoke it in the same way every time, right? So certain movements or certain amounts of pressure are always going to trigger it, right? But in centrally mediated pain, that's not always the case. So sometimes people will, bend over and it'll cause like 8 out of 10 pain. And other times they'll bend over and it's like 2 out of 10,
Mm.
you know? So we start to see things like that where we're like, that doesn't really look like an injury, type of pain. Even things like too much light or too much noise in the room or a chemical or something like that, people can sometimes respond with pain because the brain has just become so accustomed to that being its response to anything that feels like a threat.
Mhm.
And right. And the threat doesn't have to be physical injury. There are a lot of other things that the brain determines are threatening. And so, things that tend to trigger an emotional or stress response also are considered threats by the brain, right?
Oh, yeah.
So we see those kinds of things trigger more and more and more pain as people have chronic pain for longer, unfortunately. They also tend to have more spontaneous pain, right? Where, maybe they're just sitting there, watching TV and suddenly, boom, the pain starts to come on and they weren't really doing anything. Maybe sitting is not usually even their trigger, but suddenly they're having pain, right? And so we do tend to see those kinds of patterns where things kind of progress and get worse and worse in various ways, but it's really, and those patterns don't make sense again with that acute pain pattern. So,
Yeah, it's interesting because of this. You mentioned these triggers, and I can't help but think of we work with a fair few patients that have CRPS, the
mhm,
complex regional pain syndrome, and
yeah.
that the way that pain spreads from this small little localized area, original injury, right? Like they broke the toe. I had one guy broke his pinky finger, and then the inflammation and the swelling and just the way their nervous system reacts to everything. The temperature changes. They can tell a storm is coming because they start to experience pain.
Yeah.
And it's really fascinating that the brain has that capacity to kind of create this pain whenever it wants and not when it needs to. And so this has to be, we've always kind of looked at this as some sort of brain or nervous system dysfunction, right? How can it be the way it's supposed to be? And would you say there's some I know we're talking about chronic pain here, but would you say there's some connections as well to issues with long haulers, COVID, and the brain? People seem to develop weird triggers like their brain has been rewired from that even.
Mm, I have seen that. I have seen that it's very common for people to develop like anxiety and panic out of the blue after having COVID or during their long COVID experience, chronic fatigue and things like that. And funny enough, this approach that we're going to talk about today for rewiring the brain for pain also seems to help a lot of people with long COVID to come out of it.
Yeah, that's perfect. Okay, well, we're going to dive further into that in a minute here. So now the brain is often associated with emotions and, the behaviors that we do. So what emotional and behavioral reactions might someone with chronic pain kind of start to engage in that could make them maybe think it's going to make them better, but ultimately maybe it'll make them worse.
Yeah, there's a number of those. So I would say, as we were talking about, one of the first ones is just getting really fearful of the pain. That is like the number one, that in every research study on that, on whether somebody was afraid of their pain, outcomes are always worse. Right. And so I think one of the important takeaways for people that are struggling with pain is that even though it's incredibly uncomfortable, you are not technically in danger in most cases, right? It would have to be something pretty severe and pretty acute typically for that to be an actually indicator that your life is in danger, right? Usually when that's the case. When
Yeah.
you are in, pain, that's not what that means. Pain is trying to get your attention and say, "Hey, there's something wrong." But when somebody's brain has become centrally sensitized, it's actually pain is no longer an indicator that something's wrong with your body, because your brain has gotten into that habit of just producing pain. It really doesn't have to do with danger in the body anymore.
Mm.
And so that's what a lot of people tend to think. And it's a big mistake, is that, let's say they've been in pain for 2 years and it started out at a 3 and now their average pain level is an 8. Their natural thought process is, oh my gosh, like there must be something getting much worse in my body. There must be something really wrong. Like I need to figure out what the physical thing is and deal with it. But unfortunately, that actually reinforces to your brain that the sensation of pain itself is dangerous.
Hmm.
And as a result, it goes, oh, more danger will produce more pain, right? Because pain is a protective response to danger. And so people thinking that they are fragile or that they are damaged or that they have to be careful with their bodies actually is a huge contributor to the development of chronic pain. And unfortunately, medicine has perpetuated that, right? Often people will go to the doctor, let's say they've been in pain for a year, and the doctor will go, oh, you have some bulging discs in your spine. That's probably what's causing this pain. You should just be really careful about bending over, right? And lifting things while you're bent over and stuff like that, right? And so the person will get really afraid of doing those activities and they'll avoid them, religiously. But if they forget for a moment, if they've already taught the brain, hey, this is a dangerous activity for me to do, by being afraid of it, that's how you teach the brain that. The brain will actually produce dramatically more pain when you do that activity at that point. And it's not because that activity is damaging your spine. If you're centrally sensitized, it's just because your brain learned or made an association between threat and doing that activity. Right? And so, unfortunately, people's boxes in terms of what they think they can do tend to get smaller and smaller and smaller, while the pain is getting worse and worse and worse, right? And you would think that if it was injury mediated, that wouldn't be the pattern, right? If it was injury mediated, avoiding the movement would result in less and less pain over time, but that's not what happens in these centrally sensitized folks. So those kinds of things. I would say one other really, really big one that I need to touch on is that people tend to hyper focus on the pain, right? Which is totally understandable. We tend to do this with any kind of symptom in our body that's uncomfortable, right? And part of that is because it's uncomfortable, so it feels like a threat, right? So we hyper focus on anything that we think is threatening. But unfortunately, when we hyper focus on something, what we are doing is we are firing those neural networks in the brain that are related to that more. And as I mentioned, anything you fire more in the brain gets stronger and gets more likely to fire. So actually focusing on the pain all the time makes the pain grow worse over time.
So ultimately, one of the best things someone can, and I'm sure this has been mentioned to many people before, but one of the best things we can do when we're in pain is to try and take our mind off it, right? To provide ourselves with distractions, because it's really easy to sit there and just think, oh my goodness, my leg hurts so much. Why is it hurting? This is ruining my life. And as I said, the fear even of, it's not hurting as bad as it was earlier, but if I move, maybe it will, right?
Right.
And yeah, I see that a lot too. Patients that have been told to take it easy. Like, yeah, you're in chronic pain, so maybe you don't go for your daily walk anymore with your dog.
Hmm.
And does that really help them? No, because as you said, there's not anything wrong with that area of the body anymore, just because they're feeling it. So some really, really good advice. And I know we're going to get some more in a second here, but
Yes.
so okay, so let's keep going. So how can chronic pain then be an expression of an emotional issue? And more importantly, for many people, is there research about this, right? And does that reinforce that point?
Yes. Yes. There has been research into this. And it's very interesting because actually, in some cases, the experience of pain is generated solely from an emotional event or the expectation of danger,
Hmm.
right? So, yeah, this is pretty interesting. And sometimes some of the studies on this are just showing that emotion and stress make pain dramatically worse, which is also true. But there can be times when it's just because the person expected to get hurt, or they expected a really intense emotional pain, or they experienced an intense emotional pain. So I can tell you about a few of those studies because they're pretty interesting. So they did this study where they showed people in the study either pictures that were really fear inducing, like scary pictures, or just happy pictures or neutral pictures. Actually, they did all three. And then they would, touch them with a hot probe to induce pain. And they would see how big is their pain response based on what kind of emotional reaction they're having.
Hmm.
And the people who are looking at scary photos, they always had much higher intensity of pain than somebody when they were looking at a photo that made them feel good.
Hmm.
And they also had incidences where people were looking at the scary photo and they were feeling pain, but they weren't actually being touched with the hot probe. Right. So there was not actually any stimulus for pain, but they expected to feel pain. And so they did. And so there's a lot of types of studies like that, which are pretty interesting. But the other studies that I find really, really important that I think people need to know about are the impact of chronic stress on pain and also trauma.
Hmm.
So, chronic stress is really interesting in how it impacts pain, but it's actually been shown to increase connections in the amygdala, which is kind of the danger alarm center of the brain, right? So, it is designed to perceive and notify a bunch of other parts of the brain and body about threat, about danger. So, when somebody's under chronic stress, which is, of course, the person feeling threatened for a long period of time, the connections in that part of the brain get more numerous and stronger. And at the same time, the connections in other parts of the brain that usually keep the amygdala in check, they weaken and become less numerous. And so the effect basically is that the amygdala starts sending more and more pro stress and pro pain signaling. And there's less inhibition of that. There's nothing keeping it in check. And so it just gets more and more out of control. And people tend to experience more pain and more feelings of stress as time goes on once they've, been in chronic pain for a while.
Hmm. It's fascinating because, yeah, it's all about this. So the brain has total control over how we perceive things, right? And how we put them in. And I guess perception is everything then in that case, because it makes sense. I guess if you're staring at something that's staring down the barrel of something threatening, you're going to have that expectation of threat more so than not, right? Fascinating.
Yeah.
So obviously things can cause pain, right? So people can have these old injuries and things that can end up causing them pain. So what would you say is kind of a common presentation of that? Something that people might be thinking of causing them pain, but really aren't? Because surely there are times when someone does have an aggravated injury that is actually going to keep lasting. How do you tell the difference between them?
Yeah, that's a really good question. And I would say that the type of chronic or old injury is less indicative than some of those markers that I talked about earlier of what defines centrally sensitized pain. So, there's actually this fantastic questionnaire developed by this psychologist named Alan Gordon. And the questionnaire basically asks all the questions that help you to determine, is this centrally sensitized pain or is this actually injury induced pain? And, I think any listener out there could take this questionnaire themselves and self-identify whether or not their pain is centrally sensitized. And it's not that you can't have both going on, you can, but what the chronic pain researchers are estimating now is that 85% of cases of chronic pain are centrally mediated. But it's very common for people who have centrally mediated pain to also have physical abnormalities, right? Things that look like injuries and that you would think could be inducing pain. So things like I mentioned earlier, like bulging discs or, old sprains or things like that. There was this fantastic study into this approach that we're going to talk about of rewiring the brain to relieve pain, where, everybody who was recruited into the study had pain for at least 10 years, low back pain for at least 10 years. And most of them had more than one abnormal finding on imaging in their back. So they had nerve impingements and they had bulging discs and they had facet joint injuries and all this kind of stuff. And one person actually had a 70% curvature of the spine, 70% curvature, scoliosis. And those people who had these major things going on anatomically still became pain-free by the end of the study. And the study was only 4 weeks long. And they followed up with them at a year and they were still pain-free. So, it's important, I think, to question whether or not those injuries that people are seeing really are the cause of the pain after you've reached a year of having pain. It's very, very likely at that point that that's not the source of the pain anymore.
Right. That makes sense. So with all of that in mind, 85% of people have pain that may be coming from their brain. And not to say to anyone that your pain is in your head. It's
right.
That's definitely
it's all real pain.
All real pain, exactly. But how can people then move towards becoming pain-free by rewiring the brain?
Yes. So, in terms of rewiring the brain, because pain is considered a protective mechanism that we can engage when we feel threatened, rewiring the brain to get out of pain is all about teaching your brain that you are actually safe. And that means teaching the brain that that the sensation of pain is safe as well, that all of those triggers or provoking factors that you became afraid of over time are also safe, and that you're safe in general, right? So sometimes we see that people who are stuck in chronic pain, they're stuck there because their brain feels threatened by things going on emotionally for them other than the pain. So as an example, I had this client who had been in chronic pain for several years, and she also had a ton of trauma. And I was like, okay, well, here are the things that you can do to rewire your brain in your daily life to feel more safe when the pain is present, to teach your brain that you are actually safe with the pain occurring, and that, those old activities you used to be afraid of are also safe. But in our private work together, what we did is we rewired all of these traumas from her past. And that made an enormous difference in quieting her pain, actually, in the very midst of the session and also like continuing on after that. So sometimes it's other stressors and other emotional baggage that also needs to be rewired for the brain to feel safe completely, right? Not just with the pain.
Yeah, it makes sense. I know we've worked with a lot of people that are looking for immediate pain relief. And I've actually had one patient say to me once that she knows that there are emotional blockages because she's had a lot of trauma in the past, but she's not willing to deal with them right now. And maybe we'll deal with them later if we can start to provide some relief. And, sometimes we can get people 20% of the way there, sometimes 50%. But, most of the time, I guess 85% of the time, in order to get people past the finish line, you need to work on the emotional side of things too. I mean, injuries bring with them, even by themselves, they can bring with them a lot of trauma, right? I mean,
Absolutely.
we see that, like, people that broke their leg and it's never gotten better, and that's meant that they're not able to play with their grandchildren, or they couldn't go and attend this family reunion. All of these things, they weigh on us, and they really do build up in our brain. And it's very hard not to, you talked about this earlier, kind of hyper focus on the negative, right?
Yeah.
I mean, humans seem to be so poorly wired. We're always thinking about the bad, and we're not really thinking about the good.
So true.
Yeah. So, are there any more like stories you wanted to share? A few stories of people getting pain relief this way? Because I mean, obviously, everyone's chronic pain story and experience is different, but show some diversity.
Yes, absolutely. I'll just share a story of visceral pain as well, because we haven't really gone into that yet. But you can have organ related pain as well, internal pain, not just from, you're injuring your muscles and tendons and ligaments and things like that. So that also can be centrally mediated. And actually, things like IBS and chronic bladder pain have been shown in almost every case to be centrally mediated. So I want people to know that as well who are struggling with that. I have this great case of a gal who had chronic bladder pain, and she saw me in a naturopathic capacity a while ago. And, she did have some chronic bladder infections and some toxin issues and stuff like that. We dealt with all those things, and the bladder pain got better, but didn't resolve. And so I was like, okay, let's look down this path of, rewiring your brain. And it turned out she had a ton of trauma from her childhood that she hadn't talked about, and was currently going through a really, really rough time in her marriage. And so what we did is we rewired a bunch of that trauma from childhood. We also worked on, her relationship to what was going on in her marriage, and rewiring a bunch of the stress patterning that they had set up together in their marriage. And as we did all of that, and she got to a point where she could regulate her own nervous system, the bladder pain went away. And now it only happens when she gets really, really stressed out. And when she does, she knows how to get rid of it in 10 minutes. And she does it by addressing her nervous system, by addressing that threat response system, not by doing like taking a pill for the pain or whatnot. So, yeah.
Perfect. So it's really actually, when you do that, right, it's really actually fixing the issue. Not to say, as you said, that, because I mean, pills don't fix things, but not to say that it will never come up again, because people have triggers. And if you do get put, as you said, in a very stressful situation, just like with those pictures, the scary pictures, right? If you actually perceive stress, these things can come back. But so remission or resolution is possible. You just have to pass that and rewire things.
Yes, I think that's what I love most about this approach, is that it really is a do no harm approach. It's a risk-free approach to resolving chronic pain, not just managing it, right? Because managing it is exhausting, right? It requires taking a lot of different actions every day to try to keep yourself comfortable. And nobody wants to live like that, right? People want to have the fullness of their life back. And that is what, rewiring your brain can do for you if you do have centrally sensitized pain.
Awesome. That's great. Well, thank you so much for joining us today, Dr. Cureton. It was awesome.
Thank you.
Lots of information we've learned there. So just one more note here to our audience. Make sure you connect with our guest. I will include all of her information in the show notes at painfreeforlife.com/podcast. Until next time, I'm Dr. Rob Vanbergen, and you're listening to Pain Free for Life.
Thanks for listening to Pain Free for Life. Be sure to follow us, share the show with family and friends, and leave us a review on iTunes. Every time you share the show, you are helping someone take their life back from pain. Visit painfreeforlife.com for more resources, including our free guides to microcurrent, the Hache protocol and inflammation, as well as our blog and online community full of people just like you, successfully overcoming all kinds of chronic and extreme conditions to live happy, productive, pain-free lives forever. And stay tuned for the next episode of Pain Free for Life.